Good afternoon. Today we are going to talk about medical administration. And here we are going to emphasize about neonates. And remember, when I said about neonates they are from 0 to 28 days. In administration of medicine to the neonates, there are a key thing that we should not forget. Number one, it's about weight. That's why we have weight monitoring of the neonate. Weight is used in calculation of dosage of drugs. That is very key. So we should have the weight of the neonate. The other thing, there are rights that we should follow while administering drugs. Number one, it's the right patient. And how should you know that it is the right patient? One, you confirm the name. The neonates are not talking, but confirm the name from the mother. We have the inpatient number that is written on the file. Confirm. We have other hospitals where the neonates are given the badge. So they are labeled in that badge. So you confirm. You know that whether it is the right patient. The other thing, it is the right drug. Ensure that the drug that is prescribed there, it is the drug that you are giving. For example, if it is a penicillin, ensure it is a penicillin that it is given to that neonate. Number three, it is the right dose. The right dose. Remember, we said that we calculated the dosage using the weight of the neonate. You should not overdose or you should not underdose. The other thing is the right route. That is point number 4. How do you know that it is the right route? The route is prescribed when prescribing a medication. If it is intravenous, if it is intramuscular, if it is subcutaneous, or if it is per oral drug. It is very important to follow that. The last but not least, it is the right time. The right time. How do we know that it is the right time? Time, in other words, it is frequency. In other words, it is frequency. We have a drug that is given once a day, a drug that is given twice a day, a drug that is given thrice a day, a drug that is given 4 times a day. That is the right time. Or in other words, you say it is the right frequency. Thank you. From here, we are going in the administration, practical now administration of the drug to a neonate. Welcome.
In this video, I'm going to be showing you the basics of how to draw up medication for your baby in the NBU. So to start, you always want to do hand hygiene first with some hand sanitizer, and then use gloves. And the supplies that you'll need other than gloves are some syringes, probably a needle, and then some water for injection. So for drawing up medications, you'll always need a flush to flush the cannula before and after you give the medication. So we have our water for injection here, and then for demonstration purposes, this is an actual medication. We'll say it's X-Pen. Okay, so I'll set that aside. But first I'm going to draw up the flush. So I have my water for injection. I'll just take the cap off the top, open my syringe. You'll need to draw up 2 milliliters, 1 milliliter before you give the medication, and then 1 milliliter for after. Okay. You might need to get some air out. Okay, so I have my 2 milliliter syringe. I'll put this back in the bag, making sure it's not getting dirty. And then I have my second syringe, which I'll use to draw up the medication. You might need to use a needle for drawing up the medication if it's in a vial. So you have the needle here, which I'll open, and you'll attach it to your syringe like this. Take the needle off. Okay. Then you'll take the cap off of your medication, open the vial, whatever you need to do, and then you'll draw up the medication. Okay, however much you need to give to the baby. And then you'll cap the needle again for safety. Okay, so you have your medication and your flush. Flush 1 milliliter before giving the medication. Then you'll give the med, and then you'll flush again with another milliliter. making sure that all of this stays nice and clean because ultimately it's going into the baby. So that's the basic of drawing up medication, and I'll see you in another video.
So when you are administering a drug to a neonate, first remember our rule. You confirm the 5 rights of drug administration. After confirming, do hand hygiene. Do hand hygiene. I will sanitize. I will sanitize myself. Then I will wear my gloves. For infection prevention. Then I have my drug. I have my flushing water to ensure that the line is patent. So point number 1, start by flushing the line. And before you flush, ensure our line it's very clean. It's not leaking anywhere. It's very clean. After you ensure it's very clean, take the flushing water, flush using 1 ml of water for injection. If it is patent, the baby is not crying or the neonate is not crying, no any other resistant, the cannula is okay. Go ahead, administer the medication. This is my medication. Then I will administer my medication. After I administer my medication, the last thing I will do, I will again flush my line to leave it clean as it was, using 1 ml of the water for flushing. After a flushing, if there is no any other resistance, the cannula is ready for the next medication. Thank you.